My name is Jerry Williams, and I am the founder and president of Myositis Support and Understanding. We are a 501c3 nonprofit organization. We're a patient-centered organization. And today we have Patrick Merel, and he is going to talk more about the beta smartphone app for myositis. He's with Portable Genomics, actually the founder of Portable Genomics, I believe, if I'm correct.
Exactly.
Yes, yes. So we're very happy to have Patrick with us, and Trish is on with us too. She's one of the members of Portable Genomics that I've worked with very closely to get this started, and we thank Portable Genomics for helping us provide this to our membership, as it does have a lot of benefits. So with that, Patrick, thank you so much for joining us.
Oh, my pleasure, and my pleasure to explain a little bit about what we do, our goals, and about let's say, the ecosystem of what we call today precision medicine, which is such a big term and sometimes really difficult to understand to many patients as well. So I think it's a good opportunity to tell you about our story, indeed, but as well how it takes part of this whole precision medicine initiatives. And I would love to have this kind of conversation very interacting. So maybe let me know if you have a specific question you would like to address. But maybe what I would suggest is, first, hopefully you will understand everyone my French accent. I've learned that it's has some charm. So let's see. But what I would like to offer you to start with is to define maybe a little bit precision medicine, why data is important today, and how we came with this idea for an app to collect data that we are today sharing with your community. Well, so let's start by the basic. I'm myself a molecular diagnostic expert. So I was starting by a short introduction about myself. I'm a molecular biology PhD. I've worked most of my time in the academic world as a molecular diagnostic expert involved in the diagnosis of many types of diseases, infectious disease. I've been involved during a long time with immunology colleagues for transplantation, specifically bone marrow transplantation, but I've been as well involved in pharmacogenomics for HIV patients, just to give you a few examples. And what has been transformational in that space over, let's say, less than 10 years is arriving in the labs of technologies for DNA sequencing, and more specifically genome sequencing, and bringing all of this genomic data to the physicians to help them to diagnose patients, and bringing this new type of data to the pharma industry. It was really a new step, and but believe me, 10 years ago, even with a PhD in molecular biology and an MD, it's really, and so it was really hard to understand what is the real information into genomic data. And this is how I started the idea to not only to help my colleagues to interpret genomic data, but as well patients, people at large who started back, let's say, in the 2007 to receive and to access companies who provide genetic information. So indeed, it started with consumers, but rapidly patients realized that they could have access to genetic information to better understand their condition and so forth. So my idea when I started Portable Genomics was really how to help professionals, but patients and consumer at large to access their genomic data. And gradually, as soon as we had started this idea for Portable Genomics, realized that in the picture, there is not only genomics, but there is our medical data, what makes our condition, and as well our lifestyle data. And sometimes what happened in our life, it's really so different from what happened at the doctor's office. And when we go to the doctor, indeed, we are sick. We have particular medical biometrics. But what is happening when we are back at home? And as a scientist and a researcher, I thought that was a big part of the picture was which was unexplored. So how to bring all of this medical data, this genomics data and lifestyle data all together, not only for us, the patients, the people, even the healthy people who want to better understand their condition, how to bring all of this data into a single place, and then to start mining the correlations between the medical, the lifestyle, the genomics, and eventually how to provide this data to researchers to make progress in this precision medicine field. Because when it comes to precision medicine today, it's really how we can tailor treatments and solutions to specific type of patients. This is precision medicine. And precision medicine needs data. So what is wrong today in that space for digital applications? It's all of these concerns that not only as patients, but as well as citizens that we have for the privacy and the ownership on our data. And I think this is what has driven me at Portable Genomics since the very beginning, not only how to leverage access to all of this type of data, including genomics, but in the meantime, how to save our privacy and ownership. And believe me, that's not an easy task. With Trish came across Jerry and your community to have time to explain how our platform was different in that sense by keeping users' privacy and data ownership very private. So this gave me the opportunity to start talking about the app. And while you will see many apps trying to collect various type of data, first, to collect many type of different type of biometrics, you will have to use many different apps. That's unfortunate. So first, what we wanted to do at Portable Genomics is to have a single app that will enable access to all of the type of data we may be as patients interested by. So that's the first point, bringing all this type of data into a single place and not bringing the data into a company's silo, but onto our mobile device. And this is the very, very first big differentiator our platform and application as compared to others today is that the data you are collecting, the data you are gathering, the data you are creating on our app remains on your phone. It goes nowhere else. Portable Genomics never access your data. So this is really what you may have heard in this terminology. This is a patient-centric app to the most because the data you collect remains on your phone only.
Just to reiterate what Patrick said, is that your data on this app is stored in your cloud, personal cloud, or on your device only. So just to reiterate that. Thank you, Patrick.
I think it's a big important point that I'm glad to explain, because other solutions, and Jerry, you might be here to confirm because you may have explored other solutions. Every other solution will tell you your data is private on our cloud. So indeed, you are the one to access your data onto their cloud. What they will tell additionally is probably, and I guess this is for everyone, your data is safe and secured under HIPAA regulations. So what you have to understand, that's maybe a little cooking and jargon in our space, but HIPAA rules are regulations to make your data safe and secured onto cloud solutions, silo, that are driven by companies. But what you need to know is that HIPAA rules enables as well all of these companies to share your data, to monetize your data with other third parties as soon as your data is de-identified. So indeed, when we are talking about, let's say, cholesterol data without your name might be hard to find you on the internet or to find your address. That's right. But now, as mentioned, your medical data will integrates genomics data as well. And genomics data, I'm a molecular biologist, and I review different type of papers, articles, and believe me, your data, genomics data, is never anonymized. It was already shown by the MIT probably 3 to 4 years ago already, that when you are be provided by anonymized genomic data set, they could retrieve the name and address of the individual. The reason why is that because digital is digital and often open access, there are genetic databases today on the internet that will help you to make searches. You will find, how you say, relatives with similar DNA. You will find family information from ancestry databases. And eventually, with the post offices, you will find the address related to your names. So HIPAA rules and all cloud solutions indeed are providing solutions that are secured, but the ownership of your data is breached. This is not your data anymore. You don't know what they do with your data, and you don't know if they monetize or not your data. This is very obscure. So the reason why we built, and it took time to build this technology, is that we enable you to store your data on your phone. And that's the very first big differentiator, providing privacy and ownership. So now when we come back a little bit to precision medicine, how to help patient groups like your community to accelerate research for solutions and drugs that needs data to mine the correlation between your medical data, your lifestyle, the progression of your disease, eventually access to your genetics and family histories, how to provide all of this data in a simple way and a very transparent way. So this is, again, a second big differentiator in our platform. You decide to share or not your data. But until you decide to share And until there is a project to share your data with, the data remain on your side. You know where it is, and you will know when the time has come to share, and at the very last time you can decide not to share. This is your right, and this is a very legitimate right. And all of a solution, believe me, you will say, okay, I'm willing to share, and as soon as you click yes, your data is gone. You don't know where it's going. You don't know if it has been shared really or not. You don't know if there is monetization involved, etc., etc. So here, until there is a defined project that notify you, are you still willing to share your data remain private on your devices. So that's a very big step and very big differentiator of our technology. When you see in our app, would you like to share this type of data or this type of data? We are just asking your willingness to share in the future. In fact, I should rename the sharing button willingness to share button. And when time will come, and this is what we look forward with your organization and yourself, Jerry, is to initiate conversation with group of researchers, with industry working in the space of your condition, and see how we could help them to accelerate discovery, and what type of data they will need, how many patients will make sense for them to bring into a study. And at the time, this kind of researcher group would like to access your data, you will be notified asking you, do you still want to share or not your data, because there is a project that wants this type of data that you are willing to share already. We'll need this data over a period of 3 months or just once. And there will be monetization or not, but you will know. And if there is monetization, you will know for how much your data will be monetized. And as a very third differentiator in our business model, because at the end of the day, I learned very rapidly coming from academics to the US and the life science industry. At the end of the day, there is a business model. So here is a very big differentiator in our business model. That is, if there is monetization of your data, you are part of the revenue. You are compensated every time there is data monetization. So this is as well a very big differentiator. And as this is very new, it still have to be demonstrated. But so far, I didn't see any solution that is sharing revenue of data monetization, specifically in that space of health data. So this is, and I could go now, maybe I could take some questions before we can go into details. But this is a portable genomics platform. We have built this platform with a front-end mobile app that is on iOS today, and Android later after we get new access to new fundings. But today it's on iOS. It enables patients to collect and gather data on their mobile devices only, privately, keeping the ownership on the patient side. It enables to decide if you are willing to share or not your data in the future to participate into research programs, discovery, pharma clinical trials, or clinical studies. And lastly, it enables you, and you will know every time there is data monetization, you are compensated, you are associated to the revenue. So this is Portable Genomics Platform. We have started with iOS for security reasons. And the more I read about Android and about security, and specifically data security, I'm still hesitating about the Android version, but today, for us at Portable Genomics, it's just a matter of fundings. We had to give you an example. We had started the development on iOS, and at the very start, the application, the app, was encrypting the data when saving and leaving the app. And during this development, Apple has even added into the iOS software layer, the software that runs the iPhone, an additional encryptation level. And then you all have heard about how it was difficult to the FBI to crack an iPhone. So today, the FBI and what I'm seeing in the news are the best advocates for making the iPhone a platform of choice in terms of security. And I had this conversation yesterday and today, probably with one of your participants of your community who has downloaded the app and already sent me some interesting feedback and had a question about this Android version and tablet version. So when it comes to tablets or PC or Android later, but tablets and PC, because I get the question as well to Android. Did you, if you are an iPhone user, did you ever notice that the Health app from Apple, it's not on the tab on the iPad, and it's even not on the Mac? So the reason why is security, and it's also as well how to sync the data that you may add during your day on your phone with the data on your iPad and the data on your computer. So there are possibilities to sync all of this, but this is a weakness into the security of our data. So this is probably one of the reasons I'm not working at Apple, and I wish I could have some relationship with Apple today, but I guess that the security concern is a big problem. And I think that iOS compared to Android, iOS is still a winner in terms of security. And probably that's the reason why there are more health apps that are running on iOS rather than on Android. But again, to answer your question, if we could have access, and we are still looking for fundings at Portable Genomics, as we are still a pre-revenue startup, if we could raise more money at PG and have high demand for Android version, we sure could do this. So our app can run on the iPod Touch, which is far cheaper than an iPhone. And again, it's an interesting solution because it will only connect you on Wi-Fi. So that's an interesting option when you do not have an iPhone. Another big differentiator into our app is that this is an app that you can customize yourself. We have indeed put Jerry's input into the app. We had suggestions on our side as well. But at the end of the day, you can add in this app whatever biometrics you may like to monitor, or whatever any events in your day that you would like to track and monitor. So this app, as an additional differentiator, is highly customizable by you and by us as well. And Jerry can probably tell the story when you talk about the ration monitoring. This was a simple module for data collections that we could add rapidly without upgrading this app. And the reason why this app, when it runs, connect to portable genomics server is, as I explained, not to store or access your data, but it's to make this connection with data collection modules that we can add in real time. And it's for us as well. And I'm taking this opportunity to be really transparent and explaining how this platform is working. But just a small digression here. Everything I'm telling is already on our website. That is NuMe.website. That explain how this app working, what is our privacy policy, and what type of metadata we are collecting, etc. So everything is already on our NuMe website. When you connect, as I just mentioned, when you connect, you open your app, the app connect with our server and check if there is a new data collections module that we may have added that you could have access right away. As well, it enables us to retrieve three types of information from you. The three information are called metadata. They are not data. The type of information we want to know at Portable Genomics is what type of data you are collecting with our app. And I will give you, I started to talk about the cholesterol data. I may like to know if you are collecting cholesterol data, but I don't want to know your level of cholesterol. That's the difference between data and metadata. Metadata is type cholesterol. Data will be level of cholesterol. So the app is tracking which type of data you are collecting and how many data points you have per module. Again, it's still metadata. We are not collecting the level of cholesterol, just a number of points. And the third thing that we want to know is what I was explaining a minute ago, is your willingness to share data. Because if we are talking with Jerry to various research groups or industry that would like to have project with your community, we would like to notify the patients, the community participants who are willing to share data. We don't want to bother the others, just the one willing to share data. So these three information are metadata that are being collected, and this is explained on our website, but this is the type of information that we are collecting, and that's all. Let me show you how the app is working. So because you need this this connection to our server, and for security reasons as well, when you start first the application, you are asked to register an account, connect to our server. So we don't use this data except for your password reset and connection to the server through our security connection. This is basic information. You can even put whatever you want, but you need to have your name and password. That's it. So you will create an account. So now when you open the account and start the app, there is nothing into the app. So that's a bit disappointing. But that's up to you to start with a second view. So you start with the main view that has nothing at all, just your name. So there is at the bottom of the screen a very simple menu with 4 icons. The second menu is called the modules menu. This is where you will build your own app. This is where you can access to creating a data collection module of your own, and this is where you will find modules for specific conditions that we have worked with. And the history of portable genomics had started with a patient group and community of cystic fibrosis patients here in San Diego, from colleagues at San Diego State University who were working with cystic fibrosis patients and were in need of a tool to help them with the patients to collect data all together. So we had started with data collection for cystic fibrosis patients, and have by the past talked with patients with MSA, multiple system atrophy, patients with ovarian cancer, PSP, paroxysmal disorders, and because of these conversations that we have with your community, we have designed and predefined already some data collection modules for data that you may be interested to monitor over time. So this is the third screenshot that you can see. And if I get rid of this blue thing here, and I may increase the size, you will see this is the kind of data that you probably are already collecting and monitoring yourself. So this kind of data collection module, you can add them by clicking on the little plus or minus icon, depending on the state of the module is being added or not. And then when you come back to the main menu, the main view, sorry, you have built, by adding the Myositis module, you have started to build your app with all these data collection modules for myositis. So here, before I go any further, this was initially set up from discussions we had with Jerry, and we are willing to expand this menu of type of data to add this into the predefined list for you fellows and other members of this community to use as similar modules for data collections that you may like to use. So please, you know Jerry, we have a connection now. So please let us know if you would like additional modules to be inside this panel, this predefined list. Let us know. But again, and I'm going to show you, and I think this is this next slide. Again, this app has a creation mode. So this means that, and I took this example of collecting the number of coffee I may have during a day. If you want to collect the number of coffee cups you have during a day, because it may impact, and actually it does impact my own life, so this is an important metrics for me. So just create it. This is the reason why in the module view, this is the second here, you can see on the top here, there is create your own module. So today, this creation is simple. It just enables you to create a single type of data module, but it enables you already to create a data collection module for any type of data you would like to track. It enables you to enter the value of the data you will be collecting. It enables you to enter the value range that you're expecting to collect data. It enables you to do graphics, so it will ask you, do you want to sum up all of these data points, or do you want to summarize to have the average of the data being reported? And we make as well an interesting addition here in providing what are what is the value normal range for the data you are about to collect. This is for medical data interesting because it will alert you with red reports when the data is out of range. And what is as well important, and many times it's not accessible in other type of application, you can add notes to the data. And this is up to you to create this additional part of the modules to enable you to take additional notes to the data. And something I may explain in another series of conversation, if you wish, is we can input data from wearables and from the Apple Health Kit, which is another interesting point, being on iOS as well. So every type of data that you may collect already through the Apple Health Kit, you can right away import this data into the PG app. So this is why here, with the data input field, you may select manual or Health Kit to input data from the Health Kit, and then select which Health Kit field that is of concern that you would like to input automatically into this module. As well, this is here, as you can see, in each type of data collection module, we give this opportunity to share your willingness to share this data in the future. So this is where you simply connect through this button, red or green, and you don't have to go through many web pages to opt in or opt out. This is right away and in real time. We'll know if you are willing to share or not this type of data in the future. Very simple opt-in, opt-out. And this is where you can mention that you are participating to sharing projects. And lastly, what something might be very important to you, it's for this type of data you want to collect to have a reminder. And I think this is quite interesting if you have many medications that are complicated to take over time, specific days of specific time of the day. This is where for each module that you create or that has been predefined by us, you can add all of these different features, notes, data input, sharing, and reminders. So this is a way you will add, like in this example, a Starbucks coffee module to start monitoring the number of coffees that you have during a day. But this might be so many different things. And in the research field, what we don't know about your condition, the researchers still don't know. So they need your participation and they need your involvement in the process, because maybe some data that are important to you have never been studied by the researchers, by the scientists. So we think that by enabling all of the patients to collect new type of data may bring additional information for discovery, new treatments, new explanation about the condition, etc. So as soon as you have started using the app, let's show you. So you will have basically the startup screen. You will go directly to this main view with all of your module, and then you will access the activity of daily living, the ENA panel, for each type of metric type of data. There is access to graphics. I wanted to show you. So there are a few modules that you could use: the pain, rash, treatment, swallowing. So install the app and let's have continuing this conversation with your feedback, what you would like to see. Some modification of this app from my side are very easy to do. Others will need more hard coding, so it may take longer, but so far, Jerry recommendation and solicitation have been easy to ask to answer, so we are good. But this is really a startup-minded project. We help you, you help us, and together we really want to make a difference and help the community to really leverage the precision medicine that you are hearing about in the media. And we really want these precision medicines impact yourself. So it's having patients as partners, and as partners, go and be your own investigators to make progress in the space of myositis. This is the best I can tell, and my best wishes to help the community.
And we appreciate that so much, Patrick. And this is one way, we always talk about how we need patients to get involved in clinical trials and stuff like that for myositis, because we need to be a part of the change and be a part of the things that are going to come to help us. And this is a way, if you're not able to get involved in clinical trials, this is another way that you're able to help yourself and to help other patients by getting us clinical trials set up and talking about that precision medicine and providing this information to academia, to industry and clinical trial companies, just all kinds of different ways that this stuff can be used. And we talked about the privacy and how it's very secure. And when you do share your data, if there's a project, like you had mentioned, you set up a project and you share your data, there's compensation. So, nowadays, if you submit your genomic data, say to one of the popular companies, they use your data and you don't know what they're using it for. They use it over and over and over again, and you don't get a thing in return. And that's just one part of how portable genomics is different. I have studied and talked with them for probably going on 5 or 6 months now before I felt comfortable, because you know how much I care about you guys. And I'm a patient too. So I wanted to make sure that things were, this and this and this and this before we even released the information about this. And I'm very comfortable. I've sat down. I've talked to Patrick over the phone. I've sat down with Trish in person at Starbucks. Speaking of the Starbucks module, and so this is another way that people, patients can get involved, and caregivers, if you're not able, if you as a patient aren't able to use your device to do this, ask your caregiver or your spouse or a family member or friend to input the data for you. You can set it up on their iPhone, and you have the password. They can't get into that. So.
I think what is an important step forward in all of this is that as soon as scientists and industry take seriously patients' privacy and ownership, then there is a new relationship. You are not only patients, you are real partners. And this is how precision medicine should be, having the patients as real partners. And when you have partners, you don't sell their data on their back. And you need all of this new chain of transparency, and even forgetting about the compensation thing. The real transparency. I'm asking your data and be willing to use, I will be using this data for this, over this period of time for this project. And when the project will be finished, you will know if we have failed, that's fine. We know this is science. And if there is a success, then you are associated with the success. But you have to be transparent from A to Z. And A, it's starting by you, the patients, collecting data today. This is precision medicine. So this is really changing the new relationship within all of this chain of from the patients to the scientists to the industry to startup like us being involved in the process. But this is really with transparency moving forward in this digital medicine. Yeah.
Thank you so much, Patrick. And I imagine that we'll probably set up, if you're interested, like you had mentioned, probably set up another session to go into the sharing modules on how to share with caregivers and to share with doctors and so forth.
I think that will be an interesting next step. Download the app, use a little bit the different modules, take notes, what is not convenient, what doesn't make sense, and then the next time we'll go sharing the data with reports that you can print, that you can share with your doctor at the doctor office. That will be an interesting next step. Yes, let's do this.
I agree. Let's do it. Well, thank you again, Patrick. It's been a pleasure having you join us and explain all of this stuff.
Thank you all for being there and for your interest and support. Very appreciated. Let's make this together.
Great. All right, Patrick, you take care, buddy, and we'll talk again soon. And everybody that joined us, thank you. And if you can't remember the Portable Genomics website, you can always go to understandingmyositis.org/app. And you can find all the details there. Wishing everybody a great day.
Thank you all.
Thank you, guys.
Bye-bye.